Good evening and welcome to NAMI Gainesville Special Guest Speaker Series. My name is Leanne Hibbets and I am the current president. I'm certainly pleased to see and thank you all for taking the time this evening to join us. And this evening's topic is really terrific, and I am truly thrilled to have our guest speaker, as I consider him to be my friend. At this time, I would like to turn the time over to our programs director and webmaster, Stephen McCormick. Stephen?
Thanks, Leanne. Good evening, everyone. We're really pleased you're able to join us. I get the honor of introducing our guest speaker tonight, who I've also had the privilege to work with. Demetric Watkins is the board president for the Hillsborough County affiliate of the National Alliance on Mental Illness, NAMI, and has been committed to the role and the NAMI mission for almost 3 years. Demetric earned his master's degree in rehabilitation and mental health counseling from the University of South Florida in spring of 2019. Demetric is a licensed mental health counselor in the state of Florida and a member of various mental health associations and initiatives, including the Zero Suicide Partnership in Hillsborough County. Demetric is a strong advocate for individuals and families impacted by mental illness and specializes in working with ethnic minorities and members of the LGBTQIA+ community. Demetric currently works in education, providing mental health services to children, and maintains a private practice working with adolescents, adults, and couples. So all of our guests tonight, please join me in giving a warm welcome to Demetric Watkins.
Thank you so much, Stephen. That was a great introduction. I almost thought you weren't talking about me. So I am thrilled to be here today to be able to have this conversation or this discussion about mental health in the Black community. Not only because I'm passionate about mental health, but I'm also a member of that community, and I understand and I see firsthand the disparities that our community or the Black community has when it comes to mental health and mental wellness. So today, during this presentation or discussion, we'll kind of discuss the prevalence of mental health in the Black community. There'll be an introduction to mental health, common warning signs of mental health conditions, barriers to treatment, reducing barriers, seeking support, and self-care and family support, because taking care of ourselves is definitely important, whether it is dealing with managing our own mental health or supporting a family member or a loved one with their mental health. So before we dive in, this is an interactive presentation. I will throw a few polls up on the screen for everyone to participate in. At any time I'm discussing anything on the screen, definitely feel free to raise your hand, or you can utilize the chat box to ask your question. So the first poll I am putting up now is, I want to ask everyone, who do you believe, or what group of individuals are the most impacted by mental health in the Black community? And I'll give you all a few minutes to answer. A few seconds, rather.
Demetric, I'm not seeing a poll.
It didn't pop up on your screen. It's possible because maybe you're the co-host.
Oh, okay.
Okay, so I'm gonna end the poll. Pretty much everyone who voted did say all of the above. However, I want to make note that actually as I go through these numbers, it's actually our youth population in the Black community that is the most gravely impacted right now. So just for context, in the US, 1 in 5 adults experience mental illness each year. 3 in 5 Black people experience mental illness each year, and 1 in 3 Black people seek treatment, even if they have it or have a condition or are exhibiting symptoms of mental health, only 1 in 3 will actually seek out treatment or support for that. 1 in 6 youth ages 6 to 17 experience a mental health disorder every year, and Black youth and young adults are 14% less likely to seek treatment than the majority. So now to some of the more bigger numbers or more impactful numbers. Suicide is the second leading cause of death among youth aged 10 to 14. The third leading cause of death for youth aged 15 to 24. Now, taking all of that into consideration, the suicide rate for Black youth is 5 to 12, which is 2 times that of the majority. And our LGBT plus youth are 4 times more likely to complete suicide than their heterosexual counterparts. 79% of all completed suicides are individuals who are biologically male, and Black men specifically are 4 times more likely to complete suicide than Black women. So I kind of want to open it up a little bit. Is there anyone who can share with me why they believe that Black men are more likely to complete suicide than Black women? Don't be shy, I won't bite.
Can everybody hear me?
Yes, I can hear. Hi, Monique, I can hear you.
So I'm thinking as far as completion, there's a lot of reasons that I'm thinking of. I'm thinking of, not having the children to have as a legacy that's right there, that you would feel like you're leaving your children or leaving the caretaking of your children to others.
Mhm.
And that would just be, I would say, like Black males that are, of age to have kids.
Mhm.
I would also say that I think society is not as supportive of Black males in
Mhm.
lots of ways. A lot of Black females are able to get jobs that maybe Black males are not able to get. They're accepted more readily in, a middle class job
Mhm.
over a Black male. And I'll just use education as an example. Like, Black teachers among elementary level is not something that you see very regularly because it's just not
Mhm.
acceptable to have that. So I think there's lots of reasons, but I think a lot of societal pressures, I think, are the biggest reason.
Mhm. Thank you, Monique, for that. All of those are definitely factors that contribute to that fact that I just stated. Hopefully I'm saying your name right, but Maurice indicated that they use more lethal means, and that is actually the top one. So, typically, the top 2 methods of choice are via firearm or suffocation. So, using more lethal means a higher rate of actually completing it versus, there may be women that are attempting to complete suicide, but they have unsuccessful attempts because of the means that they're using. Additionally, in addition to that, using lethal means, Black men are not, they don't have the knowledge to identify signs and symptoms of mental health disorders. So by the time, they just continue to fester, it goes untreated, and then ultimately kind of resulting in the completion of suicide. So ultimately, being mindful of the access to lethal means or just experiencing mental health symptoms and understanding what they are can help us prevent some suicides among the Black community. But it is definitely a group effort. So now I'm going to put up a next poll, just a temperature check, just to kind of see, where our knowledge sits as it relates to mental health and mental illness. And I'll give everyone a few seconds to complete that poll. And ultimately, the question is, I understand the difference between mental health and mental illness. I think it's very important when we are talking about mental health that we separate the two and understand the differences between them. Okay. All right, so what is mental health? So mental health involves our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also determines how we handle our stress, relate to others, and making healthy choices. And then in contrast, mental illness is actually a medical condition that causes a decline or significant impairment in someone's thinking, emotional processing, how they feel, and their behavior, which often results in significant distress and negatively impacts on individuals' ability to perform daily tasks or responsibilities, such as going to work, such as cleaning their home, cooking for their loved ones, things of that nature. Okay, so now let's talk about some of the common warning signs of mental illness. So, there's many, but it's proper to note that mental illness looks different for each individual. It's unique to the individual. So although, for instance, someone with depression could experience any of all of the symptoms associated with that disorder, does not mean that because I have depression that I'm going to experience all of those symptoms. So, some of the main ones that kind of stick out are feeling very sad or withdrawn for more than 2 weeks, trying to harm or end someone's life, risk taking, excessive use of alcohol or drugs, overwhelming fear, significant weight gain or significant weight loss, and then drastic changes in mood, behavior, personality, or sleeping habits. So, this is more so giving you information or knowledge on how to kind of pick up and observe some of these behaviors within yourself or, someone that you care about. However, in order to actually, say that someone, is experiencing a mental health condition or has a mental health condition, then of course that has to be confirmed through a mental health professional, such as a mental health counselor or a psychiatrist. Professionals can provide a diagnosis and help support mental health illnesses. However, my recommendation is always to engage with a psychiatrist or a medication management provider because they have specialized training regarding mental health disorders and the medication treatment of those disorders. Okay, so now I have some more polls for you. So the next one is if someone is experiencing mental health symptoms, they have a mental illness, true or false? Okay, there we go. Okay, that is correct. So everyone who answered the poll indicated false, and that is true. So individuals who experience mental health symptoms does not mean that they have a mental illness. So I'll give you an example. There are situations in life where it may cause us to experience some mental health symptoms, like we lost a loved one, or getting a divorce, or a breakup from a long-term relationship, loss of employment, homelessness. All of those life stressors can contribute to someone possibly feeling very sad or withdrawn for weeks, or potentially experiencing significant weight gain or loss because they may be stress eating, or they may not be eating at all. So it's very important to understand that just because you're experiencing these symptoms does not mean that you actually have a mental illness. Okay, and then our next poll, um, because we're going to start to talk about some of the barriers to treatment, but I want to ask you all, what do you believe is the main reasons individuals do not reach out for help when faced with mental health issues? And we have lack of access to care or support, stigma, the belief that mental health is not real, and the belief that an individual can resolve their own mental health issues on their own. I'll give it a, Fear is definitely a good one, Leanne. And everyone that participated in the poll indicated stigma as the main reason, which is the correct answer. So we're going to go into the barriers of treatment. And we're going to start with stigma. So stigma is a set of negative or unfair beliefs that individuals or groups of people have towards a specific group. And in this case, and based on what we're discussing, that would be individuals living with mental illness. Now, within the spectrum of stigma, there are different levels to it. So we have internalized stigma, which is the negative beliefs that we hold, that the individual holds internally, which could be shame or guilt or feeling like something is wrong with them or feeling like they're defected or defective. You have public stigma, which is basically everything that we see around us or society as a whole, and those that hold those negative beliefs against or discriminatory beliefs against individuals living with mental illness. We have professional stigma, which is mainly rooted in fear and ultimately based on a healthcare professional's ability to understand or not understand what mental illness looks like and how to recognize those symptoms and treatment options. And then we have institutional stigma, which basically involves any type of policies or procedures from the government or corporate or other organizations that limit the opportunities available for people with mental illness. Now, in the Black community, many historically Black people view mental health conditions as a consequence of personal weakness, kind of contributing to the shames and fears about having a mental health condition and that discrimination or stigma that may follow. So that also contributes to why the Black community has a low percentage of seeking help for seeking mental health treatment. Additionally, in the Black community, we typically seek support from our faith community rather than seeking a medical diagnosis. As the faith institution in the Black community plays a very central role in meeting place and a source of strength, which is completely fine, but we don't want to negate that mental health is a challenge or issue for the community. So you don't have to choose one over the other. I can still engage in my faith. I can still actively be a church member and lean into my faith when I need to, and still take care of my mental health and or have a mental illness. Okay, so barriers to treatment. So we're still talking, so before stigma is the main one, which is why that was its own separate slide. Now we're going to talk about some of the additional barriers to treatment, which include racism and discrimination, cultural differences, socioeconomic status, lack of access to care and treatment. That can look like, not having health insurance or inadequate coverage, lack of transportation to appointments, and we do offer, telehealth is a thing now. However, you still have to have the technology to be able to meet, to have those sessions. So that's also another barrier. And then lack of knowledge of available resources, because there are many organizations out there that offer free support and free therapy services to people in underrepresented populations, as well as individuals who may be having some financial struggles. And then ultimately distrust in the healthcare system. So, ultimately, we know that historically, Black people, there's a lot of stereotypes around Black people and health altogether. Like, we're not always believed when we come in and we describe symptoms. You know, one of the stereotypes is that we have a high tolerance for pain. So when we're walking in, you know, and we're saying that we're at a 10, then, you know, most healthcare professionals are figuring that we're exacerbating that. So, and we don't get the help that we need or that extra follow-up that we may need. And then, you know, all aspects of our life impact our mental health, but also another example of what I was just discussing is how Black women are more likely to pass away after giving birth due to post birth complications rather than their white counterparts because of the stigmas and the stereotypes that are placed on the Black community regarding pain management and how we explain what we're feeling and what we're going through. So reducing stigma and barriers. So, you know, the thing that I want to highlight the most is education. Seek knowledge, seek education, gain that information and move out of that place of blissful ignorance into a space where you know what mental health is, you know some of the common warning signs, you know how to support one of your loved ones who may be experiencing it because you have knowledge of it. And the great thing about knowledge is that it can be passed on forever. You know, there you can take the knowledge that you have and give it to your family members or give it to your friends or your coworkers so that we're expanding how much people know about mental health and mental wellness. Understanding the importance of seeking help, especially for the Black community, because let's take a little sidebar for a second. So the reality of the situation is that, or the grand scheme of things is that the Black community, we were born into trauma, you know, slavery. Then we have racism, systematic oppression, still experiencing, you know, a lot of, you know, generational trauma within our families, vicarious and recurring trauma. And vicarious trauma is basically indirect or secondhand trauma, meaning that I'm witnessing something that is causing, that makes me traumatized. So, you know, for instance, in the Black community, like when there's, you know, deaths by police officers and those situations, that's vicarious trauma, that's recurring trauma that, you know, our community kind of faces on a day-to-day basis, you know, almost, you know, leaving the home and to be honest, and I'm going to be, you know, this is a real talk conversation, but not knowing if when I walk out my door, if that's going to, am I going to come home? Am I going to be pulled over, racially profiled, or judged by the color of my skin and may not make it home that day? That's the reality in the Black community. So, you know, from there, we want to facilitate more open conversations about mental health, normalize checking on one another regularly. And when I say checking on each other regularly, like asking better questions so that you can understand what your loved one is going through. So, you know, if I were to ask everyone right now, hey, how you doing? That automatic response is, oh, I'm okay, I'm fine, good, but you're not really telling me how you're doing. So, you know, just a simple change in how you pose your questions can get you more different information. So instead of asking, you know, someone how they're doing, ask them how they've been feeling. And when you ask someone how they've been feeling, that will cause them to take a pause, reflect, and then they'll be able to then have a different type of conversation or dialogue with you about what they're going through and what they're feeling. A very big one is normalize that it's okay to not be okay. And then another one that a lot of you know, that we don't hear about often is find ways to participate in research or clinical trials. And the reason that I'm saying that is because a lot of these statistics are based on a small sample of people because Black people are not seeking treatment or participating in some of these studies so that we can understand what it's truly like for what mental health truly looks like or mental illness looks like in the Black community. So we need more people to come together, more people to, describe their experiences, whether it's, a firsthand account or whether it's an account of a family member or a loved one. So not only does that allow, the mental health community to understand our experience better, but it helps inform effective treatment approaches, because the way that depression for a Caucasian individual is going to look different from depression in the Black community member. So you want to make sure, but if they don't have enough data about effective treatment for Black people, then guess what's going to happen? They're going to take you through that same approach that they would with someone from a different ethnic group, and that's not going to be as effective for you. Any questions on anything that I just discussed from anyone?
So, Demetric, I've heard of this new research program called, I think it's called All of Us.
Mm-hmm.
This is a national campaign to get participants to kind of participate in surveys, and
Mm-hmm.
I guess it's like a genetic thing, so they can kind of gather some data that will kind of inform decisions that are made for
Mm-hmm.
people in general. But
Mm-hmm.
I think that their biggest way to campaign it is to actually get a lot of people of color or marginalized people to get involved. I think
Absolutely.
I've heard of that one. Yeah, so, just wanted to throw that out there. It's called allofus.org.
Thank you. Thank you. Stephen, do you mind putting that in the chat for our participants? I think that's a great idea. And I think that, we all have a responsibility as professionals, organizations, as a community to, promote these type of things. A lot of people don't know that these clinical trials exist, or that there are surveys out there to get their experiences on certain topics, or they don't understand the importance of participating in those type of activities. So, it's our job as a community to help educate on why we need more members of the Black community to participate in a lot of these studies and these research, so that we can make sure that when we're training non-Black mental health professionals, that we're giving them that information that they need to provide us with effective care and treatment. So seeking mental health support. So this is a big one. First I want to say representation matters. If you want to find a therapist that looks like you, there's going to be more relatability there, a different level of understanding there. And, ultimately, we're not saying that non-Black healthcare professionals can't provide effective care, but it's just a different level of connection and relatability when you're talking to someone or working with someone who looks like you. Ultimately, in any situation, whatever type of care you're receiving, there's a relationship and a connection that's at the foundation of that interaction. So if you don't have a connection with your provider, then more than likely you're not going to be fully engaged, and you may not have the most effective experience or treatment. Take advantage of free consultations. So when you're searching for a therapist, you want to basically look at it as an interview. You are interviewing therapists for them to provide you with a service that you will pay for, whether that's out of pocket or through your insurance. Now, we talked about some of the other barriers, and some people may not have insurance, or there may not be enough Black providers that accept the insurance that you have, or you may not have enough coverage. And ultimately, especially with HMOs, you have to go with the preferred list or the providers in their network. And not all of the time do we have a large amount of Black therapists out there. So in that case, if you do have to go with a therapist because it's more cost effective that is not from the same ethnic community as you, then there are specific questions that you can ask them during that consultation to determine if they would be a good fit to support your treatment. One of the biggest questions is, have you treated other Black people or have you received training in cultural competency for Black mental health? So as I was discussing before, how there's a difference in what depression looks like for a Caucasian individual and a Black individual, that's where that cultural competency comes in, because that training will allow that professional to understand what mental health is like for that specific population, and in this case, the Black community. And, if they have not received training, then, it's completely okay to ask them, well, how do you plan to provide me with culturally sensitive patient-centered care? Because at the end of the day, you're paying for a service. As a therapist, we work for you. Now we collaborate together, we work together, we determine our goals together, but at the end of the day, you're the boss. And we follow your lead, and we use our knowledge and skills to help you reach those objectives and help you manage and regulate your your emotional regulation skills and your overall mental wellness. And then there's some other questions here. I won't go through all of them, but that's one of the bigger ones, is to make sure that, that individual has experience working with your cultural population. And then you can also drill it down to inquire about that person's experience with the struggles that you're currently experiencing. So let's say, for instance, I'm going through a divorce. So how many people have you worked with who have been going through a divorce? Or, I have bipolar disorder. How many people have you worked with who had bipolar disorder? And what are some of the outcomes for your Black patients that you support? And then after you go through the interview process, I like to tell everyone, don't let one negative experience stop you from getting the support that you need, because all therapists are not created equal. And when I say that, meaning that, it's no different than going to the doctor. Sometimes you find an excellent doctor, and then you find a doctor that may not be as thorough as the next. So it's okay, it's not okay to have a bad experience, but we don't want that bad experience to become a generalization of what it's like to engage in therapy or mental health support. Now, I put some reflection questions down here. These are some of the questions that you want to ask yourself as you are having these consultations. Did they communicate with you with respect and dignity? Do you feel like you were treated that way? Are they communicating well with you? Do they offer, or are they willing to integrate your personal belief, practices, identity, and cultural background into your treatment? Because all of that stuff matters. Because if I'm a Christian and that is the source of my inner strength and my go-to coping mechanism or support system, then I will want to integrate that into my treatment. Now, can that therapist do that for me? Because there are Christian counselors out there who interweave both. So, you'll still learn all of the helpful tools to help you mitigate the challenges that you're experiencing, or help you maintain or manage your mental health or your mental wellness. However, they will also incorporate the use of your religion if that's something that you hold true and near and dear to you, as far as how you expect to walk through your mental health journey. And then the most important one of them all is, do I feel like my provider understands and relates well with me? That is a very important thing. When you're looking for mental health professionals, at the end of the day, it's still a human to human interaction. And if you don't feel understood and you don't feel that you relate to your provider or you have a connection with your provider, then my recommendation would be for you to seek other options, because that one-on-one relationship, that personal connection, is very important to build that therapeutic relationship with one another, so that you can feel comfortable enough to be vulnerable. Being vulnerable is a very big part of therapy. You want to make sure that you're open and vulnerable so that that professional is fully equipped and has the knowledge and understands your plight, so that we can develop those treatment plans and those objectives that are closely aligned with what you're experiencing, how to manage it, as well as all of the goals that you're trying to reach, or that version of yourself that you are trying to reach. So self-care and family support. So self-care is really important. I like to use this analogy all the time. I'm pretty sure everyone has been on an airplane, and maybe some people may have not, But when you're on the flight, before, it takes off, the stewardess, they come to the front and they go through all of these instructions about what you do in the case of emergency. And as a part of that presentation, they say if the cabin loses pressure and for any reason those masks fall from the cabin, to put your mask on first before you attempt to help someone else. That is the same thing with self-care. If I'm not pouring into my own cup, if I'm not taking care of myself, how can I truly show up in someone else's life and support them? How can I ultimately, practice what I'm preaching if I'm not doing the same that I am, asking you to do? So ultimately, self-care is the practice of taking an active role in protecting one's own well-being and happiness, especially during periods of stress. And I listed some examples here. It's not it could sound like a lot when you say, okay, you need to create a self-care routine or a self-care plan, but you just want to take into a consideration that you want to keep it simple to start. And from there, then you want to set aside specific time just for yourself. And then another option is getting back to the things you used to enjoy, because sometimes life pulls us in different directions, or we have increased demands at work, or our children are engaged in a lot of extracurricular activities that require you to drive all over town and do all types of things that pulls time away from yourself. So setting aside that specific time or getting back to those things you enjoy is a great start, or finding new interests and hobbies. It's never too late to find a new interest or a new hobby, and then the most important piece is that once you establish what your self-care routine is going to be, that you incorporate your self-care into your schedule, meaning that, okay, on Tuesdays from 6 to 7, that is my me time. I'm going to do whatever I want to do. I'm going to go for a walk. I'm going to go exercise. I'm going to pray. I'm going to fast, meditate, go get a massage, spend time with my friends, but just making sure that you're including that in your schedule so that you're more likely to actually maintain it if you do so. But if you say, I'm going to start, going to the gym and working out, that's a very loose and vague goal. So what is really the likelihood that you're actually going to do that versus saying, you know what, on Tuesdays and Thursdays, I'm going to go to the gym as soon as I get off of work. So that's like, I'll get there around 5:30. You know what I mean? And, ultimately, you just want to make sure that you're making yourself a priority, and making yourself a priority, even when you have other people looking up for you, even when you're responsible for other people, that doesn't matter. It doesn't mean that you're being selfish. Actually, what it means is that you're actually equipping yourself to be more effective in the support that you're providing for those who you're responsible for. So, all of us, don't experience mental health, don't have a mental health condition, but we have a family member who does. So, I want to kind of talk about, different ways that you can support your family member who may have a mental health condition or mental illness, so that you're better equipped to support them. So first, you want to educate yourself on your loved one's mental condition or illness, and you want to ask specifically about their symptoms and how their condition impacts their everyday life. Kind of going back to, what I've been saying throughout the presentation is mental health is unique to the individual. So although there are standard symptoms or common symptoms, it looks different for me than it would for someone else. So asking that person what it looks like or how it shows up in their life will give you a better understanding of what their experience is like. And also it'll help you understand what they're going through. And, ultimately you want to also remember that your loved one is the expert in their mental health journey. So you can't tell, regardless of the information or the knowledge that you have acquired from, research, reading, whatever the case may be, does not mean that you are the expert on their mental health journey. You want to also learn how to recognize when your loved one's mental health may be declining or a crisis may be developing, because ultimately we want to strive to be proactive and not reactive. So in this particular area, you want to make sure that you are actually trusting yourself, because you know how your loved one is when they're at their regular functioning, or before, you know, how their behavior is before they're having a crisis or an episode. So that will allow you to utilize that historical information or that historical relationship that you have with your loved one to be able to kind of pinpoint if a crisis or, you know, their mental health may be declining. And then normalize reaching out for help from your family, your friends, your community. Your local NAMI has a lot of support resources for individuals living with mental health conditions, as well as the loved ones of individuals living with mental health conditions. We have church and anything out in the community or organization that supports mental health. Those would be great places to start to determine what type of resources are available out there. Now, another big thing is, especially when you have a loved one who's over the age of 18, you have to remember that you do not have control. All you can do is plant the seeds, check in on them, and let them know that you're there to support them and offer them some resources. That's pretty much all that you can do. You can't force them into treatment, especially when they're not deemed legally incompetent, meaning that if they're still able to make sound decisions for and take care of themselves, then there's no legal action that you would be able to take to make them engage in treatment. So all you can do is really support them and just plant the seeds and hope that they grow. And then continue to be there for them throughout that journey if they're hesitant or resistant to getting treatment. You know, another way to kind of ease someone in is maybe find a support group where they can then see other individuals who are experiencing some of the same things that they're experiencing or have been through some of the same things they're experiencing, and hear about those, you know, positive stories and positive outcomes, which will more than likely help lead them to more individualized or unique treatment. Thank you for your time, and I'm going to open it up now for questions. But before I do, I just want to, you know, kind of circle back to, you know, how we started with who's the most impacted in the Black community as far as mental health. So yes, all members of the of the Black community are impacted by, lack of access to care, barriers to treatment, stigma, all of those things. But our youth are suffering the most. And what my recommendation would be, or if I were to give you any advice, any parents, any advice, if you're watching this, is to take the cues and listen to your children, regardless of the beliefs that may have been bestowed upon you from the generation before you. So ultimately, if your child is coming to you and saying that something's wrong, or that they want to go to therapy or talk to a therapist about what they're going to, believe them and connect them. Because at the end of the day, I'm the expert on how I feel. So if I'm coming to you and telling you how I feel, then there should be no barrier to me getting the support that I need if I'm actually coming to you. And also look at that is also a part of the trust that your child has with you. Because if I come to you with the problem and I'm like, I want therapy, and then you're like, no, we don't do therapy, therapy's not a thing, then that's going to damage some of that trust. And then ultimately that can cause your youth to hold all of that stuff in. And as we discussed earlier, the suicide rate amongst Black youth is high. So, we want to provide those safe and open spaces for our youth to get the support that they need. And these newer generations are starting to unlearn a lot of the stigmatizing, notions of what mental health is and what it's not, that have been kind of passed down from generation to generation. But at the same time, they're under the age of 18, so they have to have your consent to get the support that they need. So all I'm saying is, if that your child comes to you and as asking for help, regardless of what you personally believe is going on, get them the help that they need, because they're going to be better for it in the long run. And then that way we everyone can be in a space where there's no resentment, no regret, or we're faced with a situation where our loved one is no longer here because they felt like they didn't have anyone or anywhere to turn to. Okay, I'm going to stop sharing my screen now and open it up for anyone who may have any questions.
I have a question. Go ahead.
Absolutely.
If a barrier to receiving care among the youth, and I'm going to try to say this bluntly because we're adults and hopefully we have thick skin.
And I want it bluntly.
Okay, is their parents, because the parent doesn't believe in therapy. The parent doesn't think that counseling is the cure, whether it's you gotta buck it up, toughen up, suck it up. How do we reach the parent? And I guess my second question is how, when the child does make that initial appointment or the parent makes that appointment on behalf of the youth, do we need to establish rapport with the parents, and how much rapport should we establish with the parent? And should we spend the bulk of that appointment educating them about the process, about who we are? How do you approach that? Because I think in that situation, you have to gain the parents' trust before you can gain youth's trust.
Absolutely. Absolutely. So all of that is part of the therapeutic process. So if, for instance, in my private practice, when I am working with adolescents, my process is to meet with the parent first, to understand and build that initial rapport with the person who I am legally obligated to talk to, but also that person who has that background information on the client that I won't be privy to because I don't live in the same household. So I talk to the parent, and then I talk to the adolescent individually. And the reason that I do that is because, parents are authority figures. So if I ask a question to an adolescent and their parent is sitting next to them, then they may not either answer it truthfully, or they may, they may not just answer at all. Because out of fear of how the parent will react. So I usually meet with them separately. But yes, in a situation where you're working with youth, you do have to establish trust and rapport with both the parent and the child. And, throughout that process, it's, our job as mental health professionals to also understand family dynamics. How does the parent and the child interact with one another? Does the child trust the parent? You know what I mean? So things like that, you want to make sure that you have knowledge of that so that you can loop in those conversations about, okay, this is what the process looks like. This is, some of the interventions or tools that I recommend implementing in the home that will help with better interpersonal relations between you and your child. Because my goal, especially when working with adolescents, is to get them to a place where they become comfortable with sharing what they're sharing with me with their caregivers. Because like I said, whether it's once a week, once every 2 weeks, or once a month, that's the only time that I'm seeing that youth. So I need to be a collaborative partner with the parent, because they're going to tell me everything that's going on at home, what's going on at school. But my main objective is always to get the adolescent to a place to where they trust their parents, so that they can be open and vulnerable with them, so that they can share with them some of the same things that they're sharing with me, and not have fear of consequences or ramifications. Did I answer your question, Maurice? Hopefully I'm saying that right.
Thank you
Okay.
so much.
You're welcome. You're welcome. And, just, for anyone who's watching, if there's any, questions that you may want to ask me specifically, definitely reach out to NAMI Gainesville, and then they can, connect you if you have any type of questions that you want to ask me specific to seeking support or need help with support, as it relates to Black mental health. Always, my door is open. I'm always willing to help. Just a little bit of my story as we get ready to close out the presentation. So I actually went through my first depressive episode when I was 17, during my senior year of high school. Now, I didn't actually know what mental health was. So I'm, going through I guess you can call it an existential crisis, because why am I so sad? Why am I having problems getting out of bed when I'm a good student, when I'm well taken care of? I have the support of my mom who loves me, and I have a good group of friends who care about me. And I go out and, well, prior to that episode, like I go out and have fun. My mom is not super strict, so I can actually be a teenager. So why am I sad? So I kind of brushed it off as what we call senioritis. And I don't know if people still refer to it as that, but basically that's school fatigue. So I thought it was school fatigue because I was, winding down, heading towards graduation. But as long story short, I kind of suffered in silence because I didn't have the knowledge to understand what was actually happening to me. I felt so alone. Um, or, I didn't feel comfortable going to my mom to say, hey, I think something's wrong, because, I kind of felt, some shame about it. Like, why am I different from everyone else? And I was raised in the church, and, and I still, still believe in God, and my faith is, I lean into my faith all the time. That is one of my go-to coping mechanisms to get through some of life's struggles. But during that time, when I was growing up in the church, I was taught that, you pray, lay it at his feet, and it is done. Move on. So, as I'm going through this depressive episode, then it's actually exacerbating, because I'm praying like I have never prayed before. And I am just sitting here like, well, God, what is wrong with me? Why can't I pray and lay it at your feet and it be done? But the reality of the situation is that is true, but there was another statement that I was not provided. So basically, that is true, that, in my faith, I can go to God and lay it at his feet and it's done, but I have to take action. There is still something required of me, because faith without work is dead. So although I'm bringing it to his feet, but what am I doing to change my situation? And I wasn't given that piece. So I think, and Maurice, to kind of, go back to how do we educate, the parents and everything like that, is engaging, our community and faith leaders, because, the church is a staple in the Black community, and the leadership in our, faith network carries a lot of weight. So we need to start having the conversations there, engaging them in events or opportunities to where we can have these open conversations about what mental health looks like, and actually giving that prevalence of mental health in the Black community, because a lot of people don't know how disparaged the Black community is when it comes to mental health. So that's why I always start any presentation or talk that I give with the statistics, so that you could truly understand how we're suffering. Because when we're aware of something, then we can do something different. Any more questions for me? Yes, Leanne?
Hi, Demetric.
Hello.
I guess it's not as much of a question as in a remark, if you don't mind.
Mhm.
A couple things that you said really resonated with me.
Mhm.
So if I could share that, I would
Absolutely.
like to do that. You remarked, and I'm not quoting, I don't write that fast. You made a remark about not knowing in the persons of color community, you're
Mhm.
talking about not having that feeling that your your safety's in jeopardy, or am I going to come home safely this evening,
Mhm. Mhm.
etc.
Mhm.
And that's not the first time I've heard that.
Mhm. It's true. And I know it
It
wasn't a question,
resonated with
but
me
it's true.
because a friend who is a person of color
Mhm.
and I were having this very very candid conversation,
Mhm.
and she let me know about exactly what you just said.
Mhm.
And it's
Mhm.
like, when you're really hearing, not just you're engaged in a conversation, you're there, but you are hearing that person
Mhm.
and they're telling you this, it like reached into my soul, literally right through my chest,
Mhm.
and squeezed the heck out of me.
Mhm.
And so mental health, I can only imagine.
Yeah, and it's tough, and thank you for making that remark. I do appreciate that because it is tough, and in most situations, and it's we try to refrain from saying try to be politically correct, but the reality of the situation is that it's very difficult. It can be very difficult and challenging sometimes to be an African American in the world that we live in. And I'll give you my own personal experience. If I were to leave and go in my car right now and the police got behind me, doesn't even matter if they're probably minding their own business, probably not even paying me any attention, I'm anxious. The fact of the matter is that now, unfortunately, when I was growing up in my generation, we were shielded from certain things because that wasn't appropriate for children to know. Now, in this current climate that we're in, especially in the Black community, we have to have very difficult conversations with the youth too early now. Like we have to talk to them about, what do you do if you're approached by a police officer? And we know that not all police officers are bad, but we also know that all of them aren't good. You know what I mean? So we have
Agreed.
to have these conversations with kids way sooner than we should have to, or even at all. you know so I still experience anxiety when if I get pulled over, or if I see a police officer next to me, because I don't know, especially at night. In the daytime, not so much, but especially at night when there's not a lot of traffic, or I'm not in a well-lit place. Like, there's a lot of different rules that you must follow. Like, okay, how can I pull what they need from me out of my glove compartment or out of my bag quickly enough to where by the time they get to my window, it's in my hands and my hands are visible. Because, just personally, if I have to reach in my glove compartment, of course, I'm going to let them know what I have to do in order to get them what they're asking for. But there's fear because I have to reach into a place that they can't see. So, that's just, that's part of it. That kind of goes back to, some of the things that contribute to, some of the high rates of, mental health amongst the Black community.
Mm.
Because, back in the day, I don't know. It's just, we have to adjust to the world that we live in, but at the same time, we have to understand how important it is to come together and understand what's impacting our community so that we can do better, so that we can help each other, so that we can support each other. I work in education, when school is in session, and I had a young lady come to me bawling her eyes out and wanting to engage in therapy, but of course we need parent consent, so we called the parent. I even coached the young lady on how to present it to her mom, and at the end of that call, the mom said, "No, that's not a good enough reason to go to therapy." So this is what some of our youth are experiencing when they're reaching out to the people who are supposed to protect them for help. And in my perspective, regardless of race or anything, if your child is asking to go to therapy, let them go to therapy. That's a good enough reason in itself. You know, so it's very disparaging, but I hope that as we continue to have these conversations like we're having now, and we continue to partner with other leaders in our local communities, that we can start to spread that awareness and start to change some of the attitudes that we have, because like I said before, like the Black community is rooted in trauma. It's rooted in trauma. So it's and one thing I like to always say is it's not the parents' fault necessarily, because it's not necessarily intentional, as more so it's been programmed in them from generations before them and before that and before that. But ultimately, through that trauma that our history is rooted in, ultimately we've been in survival mode our entire life. Everything that we do is rooted in survival. So if I'm always worried about surviving, I don't have time to think about how I'm feeling. I just know that I need to do, I need to make sure that, if I get pulled over, that I do this, that I listen, that I don't, sound aggressive, or, I can't be sad because I don't have anything sad to be sad about. So it's really about, changing the conversations as a whole, but, everything starts within. Start having those conversations within your own family. Kind of asking each other, have you ever wonder what was going on with Uncle John? There would be some days that he would be very active and happy, and then we wouldn't see him for weeks, and I had to he wouldn't answer the phone, or he just went away. But we don't have those conversations. We normalize those adverse reactions or those negative experiences when we should actually be addressing them.
Thank you, Demetric.
Absolutely. Thank you for making that statement.
Are there any other questions for Demetric or remarks?
I think that's it. And thank you, Maurice, for hanging in with us. We a little over, but I appreciate you hanging in there with us.
It was my pleasure. I learned a lot. Thank you so much.
My pleasure, my pleasure. Like I said before, feel free to reach out to NAMI at any time. You have any questions, or you need anything. NAMI is a very great source for individuals and families who are impacted by or affected by mental illness. And if it's not something we offer, then we'll point you in the right direction, because it's our job to help our community in any way that we can when it comes to mental health.
Okay, we'll most certainly do that. Thank you again.
You're welcome.
Thank you, Demetric. I'd like to take this opportunity to thank our friend Demetric for your expertise and your sharing your soul. Thank you for allowing us to be here with you. Like to thank all the participants, and not mostly, but also the participants that weren't able to actually physically make it, that will be watching this on our YouTube channel, which you can access through our website. So
awesome.
We're going to end the recording here and just say thank you, everybody.
Absolutely. And I just want to make one little quick note that if, as individuals watch the videos on YouTube, if you have any questions, please feel free to utilize the comments, because we can facilitate more of those conversations or that discussion under the comments. And also we can address some of the questions that you may have that may have not been asked or answered during the presentation. I'll make sure that I keep my eye open for any comments, and I hope everyone stays well and takes care of themselves. And if you don't take anything else from this presentation today, just make sure that you put your mask on first before you attempt to put someone else's on.
Thank you, Demetric. And yes, let's have those crucial conversations. They're much needed.
Absolutely.
Definitely. Thank you, and good evening, everybody. Thanks again.
Thank you.